If your gums bleed when you brush or floss, even just a little, it's a warning sign. And no, it's not normal. In fact, ignoring this one symptom could lead to receding gums, loose teeth, and even tooth loss. But don't worry, today I'm going to show you the #1 best remedy for bleeding gums and how to fix it at home, fast. Bleeding gums are your body's way of saying something is wrong. It's like a small cut that keeps reopening every day. Most people blame brushing too hard, but that's rarely the case. Here's what's really happening. A sticky film of bacteria called plaque builds up along your gum line. Your body sees it as an infection, and your immune system fights back. This leads to inflammation in the gums, also known as gingivitis. But that's just one part of it. Vitamin C deficiency, stress, hormonal changes, and even mouth breathing at night can make your gums more fragile and inflamed. So, if you're brushing daily and still seeing blood, this is why. Brushing alone doesn't address the real root causes. Now, here are the signs to watch for. Pink saliva after brushing, swollen or tender gums, bad breath that doesn't go away, a metallic taste in your mouth, gums pulling away from teeth. These are all signs your gums are under attack. And if you ignore it, it can lead to periodontitis, and that leads to bone loss and eventually tooth loss. But here's the good news. There's a scientifically proven, natural way to reverse bleeding gums, right at home. It starts with a simple daily saltwater rinse combined with vitamin C, flossing, and proper brushing technique. Let me walk you through the exact steps. Step 1. Saltwater rinse, twice daily. Mix half a teaspoon of salt in glass of warm water. Swish gently for 30 seconds and spit it out. It reduces swelling, kills bacteria, and speeds up healing. Step 2. Boost your vitamin C. Eat oranges, strawberries, bell peppers, or take a daily supplement, around 500 to 1000 milligrams. Vitamin C is critical for collagen repair and immune strength. Step 3. Use a soft bristled toothbrush. Brush gently in small circular motions. Think of polishing a lens, not scrubbing a frying pan. If your bristles fray quickly, you're brushing too hard. Step 4. Floss even if it bleeds. A lot of people stop flossing because of the bleeding, but that bleeding means your gums need it most. Do it daily for 1 week, and in most cases, the bleeding will stop. Step 5. Stay hydrated and breathe through your nose. Dry mouth from dehydration or mouth breathing makes gums more inflamed. If you sleep with your mouth open, consider using a humidifier at night. Now, here's a bonus tip that most people miss. Coenzyme Q10 or CoQ10. Studies show that CoQ10 reduces gum inflammation, supports healing, and even improves gum attachment to the teeth. I recommend taking 100 milligrams a day with food. It works better when paired with vitamin C. And if you want to go even deeper, try oil pulling with coconut oil in the morning. Swish a tablespoon of oil in your mouth for 5 to 10 minutes. It pulls toxins from the gums and has a real science behind it. Let me tell you a quick story. One of my patients had bleeding gums for years. Nothing worked. She started the saltwater rinse, added vitamin C, and changed her brushing technique. After just 10 days, no more bleeding. Her gums were healthy and her breath improved dramatically. So remember, your gums are trying to tell you something. If you take action now, you can heal them naturally and fast.